And from there, like one of the biggest things I started realizing is that, you're building all this data pipelines, you have all this data coming in, but the most valuable data to your models is always the sensitive data, like your health records, where your location information, your messages, your images, all that data is very private. So there should be ways to protect individuals' privacy or companies' privacy or groups' privacy when this data is being used by AI models.
In 2020, we saw digital health move faster than ever before. But at what cost? How much do you know about the technologies transforming our world? Join us as we build our cyber consciousness.
Clearly, we have lots in common in the data privacy space. And so I'd love to hear more about your thinking around the potential for AI to really impact healthcare.
AI in healthcare, I think there's a big opportunity. Actually, I'm like an advisor to like a healthcare AI company. And the reason why I think there's a big opportunity is that a lot of industries have adopted AI. Like when you think about financial services, travel, there are a lot of companies working in that. A lot of regulations have been conducive to AI being supported, but healthcare, a lot of the infrastructure has been behind. And the big challenge has been that most of the hospitals which contain patient data for the longest time did not even have digital EMRs. And most of them are getting digital EMRs in this past decade. And once that digital EMR there is now you actually have a database to start thinking about AI. But there's still issues of connecting a patient data from like hospital 1 to hospital 2. Like they just don't talk. The EMR systems are not connected to each other, which leads to the problem that if like patient A goes into a hospital in Toronto and then shows up in New York, they have to figure out a way to get their health records there. And the hospital just doesn't have access. They just like have to start over. And there's so many issues around that. So I think the first fundamental opportunity I see for AI and for data there is that an ability to build like a data layer in healthcare, which connects these hospitals, these patient records. So when a patient moving from like a spot 1 to spot 2, spot 3, it should not matter. Like you can figure out like, what type of patient journey they should be going on, what type of medicine they should be given, all of those things should be figured out. But like for AI to do that, you first need this database. And I think that's the big opportunity in healthcare right now. And once that's done, amount of applications are humongous, right? Today, this company, which I'm an advisor to, they work in the medical coding and auditing space. Around 80 billion plus is lost in the medical billing processes in inpatient hospitals. All of that money is lost because like the data which is coming in, they're just like tools are just not efficient. Like you have like individuals sitting in the basement going through like hundreds of notes trying to figure out what happened to that patient. That makes no sense. A machine can help this individual do their job better, but we just don't have the machine there. But technically, we do have AI. No one's just implementing that. That's a huge opportunity. Another use case is that about the data layer. So if you think about a single hospital, they don't have a single queryable database of all patient records. They're all unstructured. They're sitting like different places. They just can't use it. It's not consumable. So this company is helping them take this unstructured data and build it into a data layer where they can ask questions. They can figure out like, hey, people with this demographic, with this diseases, what's the best patient pathway for them in the past, what's happened for them. And then accordingly, they can look at the new patient coming and say, oh, we've seen 20 patients similar to them, given with this medication, this records, they went through this patient journey and their results are positive. We should maybe do the same thing with them. So this is like, again, augmentation for the doctor. Now they can look at their historic results to make sense. Hospital utilization, how can they make questions answered? This data layer can like allow you to answer any questions related to your hospital efficiencies, care basis. These are 2 use cases which I can think about.
Thank you so much for sharing these use cases. And it's great to hear because, people, I think there's a big fear that, AI is going to replace jobs. And what you're saying is you can use AI to very much augment current roles. And that of course can lead to, more efficiencies, lower costs.
100%.
Yeah.
And like one reason I think, especially in healthcare, I think augmentation is critical, that healthcare is like, you can't be, in most cases in healthcare, if you're wrong patient, like the person may die or person may be at risk. So, you can't make those type of mistakes. The human is always needed to be at the final decision maker. So I think AI is a great augmentation to the human, and it frees them up to do the high value task instead of doing like the boring the process oriented tasks, which like a machine can do really well, which a human actually may not be able to do really well because it's just like a reputation of the same thing.